I am Alisha Prevost, and I began my professional career in 2002 with a license of bachelor's in social work at a local mental health hospital. Originally, I had set out to become a counselor. Several years into working as a social worker, I began to feel there was more I could be doing. Fulfillment was very hard to achieve with working with the population of patients I was working with. I realized how much nursing and social work were similar and saw an opportunity to better be able to apply my gifts with expanding on my knowledge base for further career opportunities. I went back to school in 2007 and obtained my LVN in 2008. I was able to work on a med surgical telemetry floor for 5 years, gaining experience and, above all, fulfillment in my job. I gained my RN in 2012 and left the hospital in 2013 to see how I would do out in the world. While out in the world, I was able to work at a local LTAC hospital, a home health, and a hospice agency. 2 years later, I received a job offer as a house supervised position with my previous employer while I was a social worker. This was an experience that led me to realize that I did not want to pursue a master's for administration purposes, for I feel I am much better at hands on nursing. I then began focusing on becoming a psychiatric mental health nurse practitioner. First, I decided to return to school in 2016 for my baccalaureate in nursing. For holistic and society construct, I felt I was able to achieve my outcome with the objectives that I learned in the class Care of Communities Nursing 4540. During this program, we learned how to assess the health of global populations and communities. We learned how to apply holistic patient centered care and address the needs of the community, such as complex health states based on standards of care, nursing theories, and evidence based practice. And we were able to uh, use the evidence based practice and the assessments that we obtained in working with these types of populations, and in doing so, performing the assignments that we did in the course, such as Introduction to Community Health and the nursing assignment, the windshield survey, which conducted of us helping a community be able to come up with a plan to be able to help it flourish with health needs, as well as to be prepared if there were a disaster were to come. There were projects that helped me become involved with the peer review at Spindletop. I learned how to write a paper about teaching plans. I learned epidemiology, as well as learned a little bit about the healthcare system within our government. And for me, an overall rating or outcome for this was with 90% average. To continue with the lifespan health continuum construct, we did more discussion topics over evidence based practice guidelines and protocols. We discussed care of patients with compromised health states with cardiac, renal, pulmonary problems, neuro problems, endocrine problems, trauma, and as well as the end of life. Again, the community based project was something that helped with this. And the overall outcome, again, I feel is a 95% as far as this construct is concerned. For the evidence based practice clinical reasoning construct, I felt that I found the most help from the Nursing Inquiry and Evidence Based Practice course, Nursing 4390. The outcomes here taught us how to research databases for certain ideas or topics that we're thinking about or wanting to research. We learned how and what the difference is, and how to look at quantitative and qualitative research articles. And we were able to have a group assignment as far as critiquing research articles as well as other classmates in order to build on our skills, better being able to understand the research articles when we do read them. With this course, we were able to analyze the major steps in the research process, differentiate between the types of nursing research, explain the link between theory and research as a foundation for the practice, use scholarly critique, a strategy to guide us through the evaluation and utilization of the research in the nursing practice. And overall, an outcome of 90% is what I felt like I achieved with this course. The professional roles construct was with the leadership and management and healthcare systems course that helped me to better be able to understand leadership in the places of employment that I work, as well as hear other people discuss or talk about. Um, with this course, we were able to learn effective leaderships and qualities. We wrote discussions and papers over this. A discussion board topics such as healthcare leadership roles and nursing and healthcare environment, and a practicum assignment that helped us to be able to initiate safety plans was something that helped us to reach my overall outcome at 95%. With professional roles, course, some of the objectives that I established or learned were the identity of political and economic and societal forces affecting the leaderships and management within the healthcare places of employment or out in the government. It explained the healthcare's team accountability for quality outcomes in the delivery of healthcare services. And it was able to help me to differentiate between the leadership roles and activities of nurses and nurses leaders. A professional role construct, again, was with the nursing leadership and management course for 550. We only expanded upon this with our global health PowerPoint presentation, which mine was over Doctors and Nurses Without Borders, which was interesting because it showed the politics and the red flags that the people that are amongst this organization have to go through in order to be able to help people because of the different culturally and governmental agencies and setups there are in the different areas that the doctors or nurses go in order to try to help these people, as well as the discussion topics over healthcare delivery and healthcare quality helped me to only gain more knowledge and continue to reach the goal of 95% with this particular course. My 5-year plan is something that I plan on starting very soon. From January to March, I hope to kind of come up with a plan or outline to be able to go to my administration to see if it's possible that I can perform a small little program with a small group of people that are willing to participate for about 3 months in meditation at work. This is something to hopefully prove that with research that I do, that meditation in work does help with a person's ability to be able to produce or to boost morale amongst themselves and others, and to promote a less stressful emotions, to be able to focus and have a much better time while working in a highly paced, stressful environment. And then from August 2019 to 2021, I hope to complete the psychiatric mental health nurse practitioner program at either McNeese or the University of Texas. And for the last 3 years, I want to just gain and grow in my knowledge with my new license so that I'm able to be more confident in myself and take off and travel for a little while while being a traveling nurse practitioner in the United States.